Great. So we'll be starting with the next panel, which is the panel 2 on ethical consideration in the digital age, balancing innovation, privacy, and security. In this panel discussion, we're going to delve into the ethical implications of digital health technologies, discussing issues related to the patient privacy, data security, informed consent, and the responsible use of emerging technologies like AI and machine learning in healthcare. It's a very, very important topic in the current market scenario. And I would like to introduce our moderator for the session, Dr. Ravi Gaur, founder, DRG Path Labs. We have Dr. Rakesh Srivastava, Senior Advisor for Innovation and Public Health, Wish Foundation. Mr. Arun Goyal, Chief Information Officer, Sir Gangaram Hospital. Dr. Vasant Venugopal, Chief Medical Officer, Clinical Products Lead. And we have Dr. Manjari Chandra, founder, Bonatra Manjari Wellness. Welcome all of you. Thank you so much for joining us. And I would hand over the discussion to Dr. Ravi Gaur to take it forward. Thank you so much, sir.
Well, good morning, everyone. And I think I was looking forward to meet you, all of you in person. But I think all this, the challenges, what we are all seeing today, I think roads are getting blocked and all issues. I think we have to turn over to the virtual mode. But then again, that's the advantage of technology, wherever we are. And that's the digital age we're talking about. So I think wherever we are, we can probably interact, connect in as close to as reality. Of course, a little different from the real one, but I think it's as close to as reality. So welcome and good morning to everyone. And this is, thank you, Sagat, for setting up this World DigiHealth and Wellness Forum. And I think it's a wonderful idea to talk about, the various concepts of digital into the health and wellness, because a lot of things are happening, and probably digital age arrived long back, but in health, we accepted it much, much later. And we're still struggling because we don't know what regulation to take, because the way it just came all of a sudden. We were not even prepared. So probably the things came, regulation, and every day it's changing and disrupting. So whatever regulation we make today, I think they become yesterday suddenly, because things are dynamic and very fast evolving. So it's the right time to hear and talk about the important topic today and moderate. So I welcome all my co-panelists. And with this, I think the important topic for today is ethical consideration in digital age, particularly balancing innovation, privacy, and security. I think this is very important today because anything what we do in healthcare, especially, it has to be absolutely ethical and without absolutely with the consent of the patient. Taking the trust is the most important factor out there. In the digital age, the challenge is not just to innovate. I think a lot of innovation can happen, but to do it responsibly. And we have to balancing the process of protection of individual privacy and preservation of collective security. That's a very, very important. And as we go through this or navigate this landscape of technology involvement, the day in and out is happening, let us remember the true measure of success lies not just in what we can create, but in how responsibly we can wield our digital power. I think a lot of things we can create, but I think many could be disruptive of no use. But how responsibly we can make use of it, that's the most important part in any case, in any technology when it evolves. And it's more so for the digital age. This is an interconnected world and rapidly evolving world. The ethical dimensions, maybe the ethics right here in this part of the world, ethics in some other part of the world, probably the culture, the cross sensibility, the gender sensibility, the population. A lot of variation happens. It's very important to have, that's why all these considerations become very, very important. And they're the one now shaping this, the linear fabric of society and influencing further the technological advancement. Today's conversation is going to be great importance. We have an extreme distinguished panelist out there, full of wisdom, new generation, and somebody who's actually connecting the both. And that will be the forum we had today. So I'll be happy. I'm confident that the panelists will be able to deliberate and talk about various, what was in the past, what is the convention, what is happening, and how we are taking this movement forward. And ultimately, what's going to be the next 10 years from now? That's more important. We'll be building up a future for the benefit of all of us. So let the dialogue begin and fit that in a seat. So I'll probably start my first question. So Dr. Shivastav, sir, good morning to you, and it's a pleasure to have you here. And you have been a very, very responsible position, and you have been driving the healthcare for many years, ex DGHS, and of course, you have been medical council director, and now, of course, which is actually the very, very social cause and a lot of doing work. My very first question to you is, sir, the ethical considerations are crucial to ensure responsible, equitable use of technology. We all know. How do we strike this balance? And in the safeguarding individual privacy and security, because without this, nothing works today in the healthcare. Digital is important. So the question: how do we make this balance? What's your understanding? Can you show some through light? What was earlier? How transition happened? And what is current status today? What should I ask, sir?
Thank you very much. Thank you. I think it is a very relevant question. We have ethical system in the regulatory process as far as the National Medical Commission is concerned, largely non-digital in nature. Telemedicine came recently, I think about 4 or 5 years back during the COVID period, without any ethical systems being developed within the whole National Medical Commission. So on one side, there is a fast moving technology development which is integrating itself into the healthcare. On the other hand, there is a regulatory system which is responsible for ethical consideration, largely unprepared for it. So let us try to look at it from that particular perspective. When we talk about the ethical considerations, if we look at the WHO classification of digital health, which is probably most recent and is relevant to us because it is targeting to SDG 3, what priority government of India has fixed for NHM and the various type of other initiatives which government is taking. It is sitting on the 4 pillars. How does clients are ethically attended to? How is provider ethically providing the services? How is the management system geared up for compliance to the ethical standards? And how it is being supplemented by the data services? To confess, I will say we are totally unprepared in these. There is only one thing which has happened till now is the Digital Data Protection Act, which has been passed out recently. It is only one component, and it talks about the security of the personal data. It talks about the various type of fiduciaries which are involved in this particular system. And it talks about many other things which are related to it. But there are large many things like how much ease of service it is providing, how much comfort to the patient it is providing, how many places it is substituting the normal services, where it is supplementing the normal services, what is the accuracy level, what is the precision level, how much system strengthening can be achieved through it, what is the role for it in the monitoring and evaluation, so on and so on. The thousands of things which require ethical consideration. So my sincere comment on this particular subject that this requires a full length, in-depth discussion so that it is not limited to the data privacy, data security, and all these issues. Now, second comment which I would like to make is health is something which has to be handled by human being. Machine and technology can supplement it. And their supplementation should be strengthening the overall outcome of the health delivery system. We don't have tested thing which can ultimately quantify and qualify that this is integratable and this is not. And the last comment is the health is for 70% of the persons who are living in the primary healthcare setup in our villages, where we have to build up our infrastructure and capacity so that we can integrate them within the system. At the end of the day, either after 5 years or 6 years, it is going to be a hybrid system because technology is not exponentially developing. It is developing 1,000 times every year. So in this particular scenario, every year new ethical challenges are going to come and we have to work for it. That is all I want to share. Thank you very much.
Thank you, sir. I think you're really, the nail hard, and probably like, yes, we know ethical things are well defined now. They're already getting in shape. But I think the biggest challenge today what we face is the unprepared regulators, because it's the way the regulators are. Because the moment your technology comes in, regulations get into processes. It's a very lengthy process, and by the time you come out of the regulation, probably the technology is already changed, disruption already happened, something more has come up. So I think just a follow up question on that, sir. I mean, what do you feel the situation should be, sir? Like today we have this. How do you make a balance? Can it be something like that? Just thought coming to my mind, sir, when you said it shouldn't be we have a regulatory authority, maybe regulations come up. Shouldn't be something, a real time regulatory authority bodies, which should be like, oil pricing, which we probably do that. So the way technologies are coming today, I think regulatory authorities have to be alert. What any views on that, sir?
I I am working in technology from 2014 with which foundation. My domain is innovation, all the technological solution, digital health solution, AI, ML. I am linked with BIREC and ICMR for validation of all the products which are coming and prioritized. And I have got a background of understanding of the things which can be handled by an authority, the power attached to an authority, and the delivery of the good services attached with the authority. With this thing, and working in the government for a long time, sometimes I become very perplexed whether authority sometimes serve purpose or they don't serve. Yes, authority is necessary. But who should own the authority? The end user or the government? Should it be participatory? Should it have a 100% dominance of the government? Should it have a participatory type of it? At the end of the day, if you create an IRDA, if you create an MCI, if you create any other type of authority, it is the human being who are sitting over there. They will make it work or they will make it work bad. So authority is necessary. But what should be the composition of authority? How do you select the persons who sit at the top and take decisions? How are they uninfluenced by the pressures which is there in such type of sectors which has got a high level of vigilance motive? So all these things need to be seen. The government work like this. You make 6 suggestions from big platforms with large number of persons attending it and following it on various type of modes, and government says, okay, fine. There is a great demand for the authority. So let us start working. They will constitute a committee, they will start working on it, sitting in an office, and at the end of the day, we get something which is useless. So that is my perception. I have tried to respond to it very bluntly, might not have appealed to many persons, but that is what I feel like. Thank you very much.
Thank you so much. I think definitely the great need, sir. It's definitely been had probably, in my personal view, going to be more of a participatory. We have a lot of experts, a lot of users, a lot of government authorities. I think something like a trial, like a mobile phone kind of thing, something like that, a body should be created which works on a real time basis. And probably that could be some solution later on, probably take a different shape. Thank you, sir. I'll come back to you again. Next, I move on actually to the next question to Arun. Arun, you are like the Chief Information Officer of Gangaram. You have a huge background of IT and kind of various corporates and bodies. When it comes to data, what's important? Because you are in the hospital even today. Who should first and foremost is the data. Now, who owns, who should own and control the personal data? Can we empower individuals to because have their own do what they want their data, or can we the patient consent? What all? And because that's very important point today. Because this when a patient comes to a hospital, data becomes hospital. Patient says my data. So can you just throw us some light on that?
Thank you, Dr. Gaur, asking this important question in this current scenario. I would like to answer this particular question in the light of Ayushman Bharat Digital Mission, the NDHM. wherein the NHA has already put in the guidelines that the patient data, primary owner is the patient itself. Wherein in the practical ground, at a ground reality, we see that hospitals are owning the respective patient data, or the clinics or laboratories are owning the patient data. So far as the facilitating the patient data available to the individual patients are concerned, based upon the consent, there are guidelines that you need to provide in a particular framework, particular format data to the patient, and that too individual data which would be sitting into their health locker, or otherwise into any cloud or any hard disk. They can keep that data with them, which could be transferable or interoperable to the other hospital. So there is another underlying guidelines which should be there, and which somebody should be driving, be it NHA or any other medical council or any regulatory body, to implement the uniform standard across the healthcare industry. So if you have a uniform standards being followed by every healthcare provider, and you are sharing the data to the patient, then that particular data will be interoperable, and would be patient will be able to share with other hospitals and other clinicians, which would become a meaningful. And patient need not to carry the huge, humongous paper files for subsequent consultancy with the clinicians. Furthermore, if you have a uniform formatted data across the healthcare industry, that particular data will become useful for the research and analytics as well, for the government governing agencies and research bodies to create analytics around the healthcare information. That's one thing. You asked about the consent. So in the hospital, people do think that when patient comes to the hospital for the consultation, it is patient's consent is an implied consent. So whether it is an implied consent or an informed consent, you need to have you need to inform patient about all the treatment which you are offering to the patient. He should be well informed about the treatment, what we are giving it to him, what will be the repercussion, what will be the side effects, and how we would be treating. So well-informed consent is important for the patient, be it implied or the informed. So that is a one thing. And in the Ayushman Bharat Digital Mission, that also has been properly defined out there using the Aadhaar card and other details with the clinical consultation with respect to the patient, be it in the hospital or in the clinics or into the laboratories or any other services with respect to the healthcare.
Okay, thank you for saying that's very important. I think in a hospital, when patient comes, basically the implied consent. In any case, for the treatment and all complications, everything, whatever surgery procedures have been done, there is always a consent separately taken also. But I think, Arun, like when we are talking about digital age, we have to develop an AI, we have to develop some data analytics, which is going to be like patient is gone, fine, over. But it's like the data what we get from them. Probably I'm going to work on 4 years, 5 years, 6 years from now, and probably that data maybe because there's a continuous evolving process. Same data which was 10 years, 2 years, 5 years, whatever the 1 year, and probably it continues being used. In that, you think separate informed consent is required, and what kind of a process should be? Because that's very gray area as of now to me. Any views on that?
Are you asking that the patient consent with respect to the data being used in the subsequent episodes, or for the future research purposes? If
from developing an AI tool or something, that's what.
Yeah, so if that is the case, it has been clearly defined into the Ayushman Bharat Digital Mission that patient consent will be taken for the data usage, and those data will be anonymized. And we will make sure that data is anonymized, and those anonymized data can be shared with the respective research bodies for the subsequent research purposes, or otherwise any government policy decision making with respect to the regional decisions, etc., for any vaccination program or any other program with respect to patient data spread over 1 year or 5 year or whatsoever it is. And the same data can be shared with the pharma industry for the development of any vaccination or any medicine, etc. But condition is that that data should be anonymized with the consent and information to the patient that this anonymized data will be using for respective purposes.
That's a very good, I think, answer, because probably what we need today is any of the healthcare providers, whenever the patient come, we do take a consent of the treatment and other handling. But I think it's very important to take that consent separately, maybe a part of our consent forms, where we can say that your data can be used for research purposes, developing a tool which is be anonymized. I think that's make a clarity in our consent form. That's I think one of the important point probably you're trying to say, right?
So in
So we'll try.
NDHB, Dr. Gaur, if you go through the NDHB, it has clearly been mentioned about such type of data sharing,
Yes.
be it anonymized or non-anonymized data. Even in the anonymization, not only the individual demographic of the patient to be anonymized, the location and the hospital is also to be anonymized, so that no one can de-anonymize the data and identify the patient from which location, which hospital he has been treated.
Yeah, I think that was going to be my next question to you. In any case, I'll come back to you because these policy exist, but how many patients are aware of it? I think how do we do that? We'll probably come back to you on the next round on this question. I think thank you so much. I think I move on to Dr. Vasanta. Dr. Vasant, welcome, and you have been doing a lot of work, especially in the couple and digital imaging and the AI development. So, what measure? Because sometimes you must have heard called Watson. I think they did some IBM this kind of a thing, the data, and they did good work initially, but the entire thing failed miserably because they had. You all know the story behind what's happened. They did a lot of work in oncology and cancer. So, what measure can be implemented to enhance the transparency? Probably the reason was with quoted somewhere. We don't know the exact reasons of those failures, but probably it was the data which was like extrapolated, or maybe the no transparency. Many a time prescriptions wrong what came out because of the base was something like new. There was no transparency in the data basically. What measures should be implemented to enhance transparency and the accountability in your technology? Particularly, especially when the automated decision making is involved. That's what because you are actually working on it for multiple times, and I'll like to hear your views from that.
Sure, sir. Thank you for the question, and thank you for the opportunity. I'm honored to be part of this panel. I just want to start with a small incident that traces back to your previous question. It's good to hear that the government is looking at anonymizing the location information while hospitals are sharing, because there is a class action suit that's being fought by Google Health. Because if you think of Google Health, they have access to the map location information of patients from their map services, and the hospital is sharing de-identified data without removing the location information with them, with Google, who is building their own suite of health solutions. Now they can triangulate these two information and go to, and they have the power capability to identify the patient. So that's kind of interesting to note. Coming back to your main question, Ravi sir, about transparency and accountability. Now I have worked as a radiologist in hospitals and now moved to be part of the industry building AI solutions. There is a dichotomy or a problem that the healthcare providers are facing today. Number one is they have to kind of, in a way, pay for the solution that they're using, and also take ownership for using the solution, right? Which is unfair, right? Anything which goes wrong because of using a digital health solution, the onus still, as of today, falls on the hospital, be a healthcare provider, a doctor, or radiologist. So the first thing is to recognize that ownership and be transparent about what technologies they are using with the multiple stakeholders, right? The first one is, of course, the government and the regulatory body. Today, CDSO clearly states that any AI solution that's being used in clinical practice need to be registered and listed under the CDSO SAMD registration framework. The first thing is you make sure as a user that whether the technology that you're using is registered in the CDSO kind of registry. The other important thing is, we work in the space of radiology, where the new age deep learning solutions are being kind of developed. And one of the problems, at least that's being kind of talked about a lot, is the black box nature of these solutions. What it literally means is you put in an input data, they will just give you an output without kind of explaining to the user how did that arrive to that particular output. You put in a chest X-ray, gives out an output saying that chest X-ray has TB without properly explaining what are the inputs that it kind of took into kind of go to that conclusions. So that's the kind of the problem with the deep learning solutions that we have been talking about. But that's a thing of the past now. Now the new age technologies have built in explainability, factors and observability factors into their solution. So as a user, when you are trying to adopt such solutions, you make sure that the solution that you're using have built-in explainability and observability mechanisms that explains things in your own language, in your not in an algorithmic or a developer language, in a clinical language, and disclose whatever you're using to all the stakeholders, be it your patients, the authorities, or the hospitals. So I think these measures can improve the transparency of using digital technologies in clinical practice.
Okay, great. I think very importantly, you said the accountability. That's a very big issue because if I am using an AI tool developed by say XYZ, now my AI tool fails, now if I'm going to be blamed or XYZ has to be blamed. I think this is a very very great important point. So all the more that's the reason there should be transparency and a very well defined accountability because it's not like you have a data what your tool you developed probably is a very transparent data which is passed on to the user and have a full kind of a system. Anybody can have foolproof check. I think this is, I think, what we need today. And there have been some, I think, guidelines on it. There have been some processes on it. But I think we need to really drive that hard because there's so many companies, the newer age groups that are coming out with a lot of AI tools, and especially for the healthcare, where there's always a need and demand. Disruption is a need because bigger cities is fine, but when it comes to the tier 3, tier 4, remote area, the last minute or the post there, they definitely need these solutions because that otherwise with healthcare, the way they progress, I think next 10 years, we may not be able to reach the last man, the desired benefits. So I think it's very important, the point to be noted. I think all of us working in this field, we should talk about wherever you're using an AI to go back, get the data, learn, and the AI developer should also have a data which is actually with a full transparency and the foolproof because it should not be many a time like because once you anonymize the data, you don't know data is like X has been repeated 5 times or 3 times. Probably we're not even aware of that. So I think then I think just a quick question follow up on this, we are talking about see what could be the how do we address this minimize this algorithm bias? Because this basically is analytics algorithms have. So how do you minimize this biases in decision-making systems? Because you have worked on it, I think probably you can guide us and tell us.
Sure. So I can kind of draw examples from how do we approach this. So we, in the radiology space, there are 700 plus FDA-approved AI solutions that are available for use in hospitals, right? You pick a simple problem of a chest X-ray diagnosis. Today, there are 15 mature global companies FDA-approved that have that can do that solve that problem. Now, the way we approach is we go to a hospital, give them a testing access to all these solutions within their environment on their own data and help them to run a robust testing process, comparing all of the solutions and help them pick which is the right solution for their own data set. If a hospital has multiple centers, we also help them to identify if there is a particular solution which works best on a particular center, particular modality, particular age group, particular vendor. So all those kind of deep driven analytics, we help them to do that using a platform-based approach. So wherein we cover number one, the data stays within their environment. They get access to all the best possible options there. They do their own robust testing and choose the best solution for them. Now we don't stop with that. We help them also to periodically monitor the solution when it is deployed. It's very important that you have done a pre-deployment testing. You are sure that this works fine on your retrospective data or historical data. It's not necessary that it will stay so because there is a challenge of data drifting, right? Suddenly COVID comes in, everything changes, right? The entire distribution of patients changes, the new disease entity has come in over the past 3 years. How will your solution perform in such a drift kind of situation? So we help them monitor it. And there is a lot of education and training that needs to go with the users, the hospitals, the radiologists, the technicians, the clinicians. All of them need to be educated about the right way to use the AI solution, right? Because if you don't know, what are the limitations of the AI solution, you're just kind of blindfolded by only the benefits. It's going to be very risky to use those solutions. So these are the 3 steps: pre-deployment testing, education, training, understanding the limitations, and continuous monitoring post-deployment. So these are some ways we can mitigate these challenges.
Great. I think that's a good, thing. We ought to be all careful. AI is definitely helpful, no doubt. It's already here. So I think it's got a, whether it's a hype or a hope, peril or perish. I think these are the things probably time will tell. But of course, it's a tool is a right, and without that, we can't survive. But typically, whatever we're doing is we need to be transparent, we need to be accountable. And I'm sure a lot of policies and processes have been evolved. But and a lot of training, awareness, and a lot of things. I think we need to keep holding all this time together for everybody till it's a streamline. I think it will be in a continuous process, not in a one-time thing. Thank you. We'll come back to your next question. I think I move on, Dr. Manjari. Dr. Manjari, thank you for joining very short notice. And I think, you are really working in the space of wellness, and which is like a very, very a private space. And, do you think there should be a separate ethical guidelines to be in place to govern the collection, storage, use of personal data, and especially, like when you talk about business and government entities? Because we have like nutrition, we understand what I'm trying to say. So what should be the ethical guideline? And in our society, what should be we as an approach to these ethical implications of emerging technology? Your views, please. You're on a mute, I think.
Thank you so much, Dr. Gaur, for the question. It's an absolute pleasure to be here. As compared to hospitals, as you said, in the space of wellness, we have a little bit more data, and sometimes data which is specifically not just clinical, but personal data, a lot of behavioral data also that we are able to collect for the people we interact with, or people who become our patients and patrons. One of the things, in the ethics of data, especially, I think there are 3 basic pivots that have to be adhered to whenever we are looking at the data being ethical and ensuring that the ethics are not compromised. I think the first one is to have a respect for autonomy, when the person's autonomous, right to that data is the first thing. The second is ensure that we are only doing good with that data. The intent of collecting the data is to do good, and that there is no harm which will happen as a result of collecting that data. Because let me give you an example. For example, a lot of data about behavioral patterns of people who have, for example, eating disorders, or people who have, morbid obesity, can also be harmful and can be used in a way where it may not be beneficial to the person whose data it is actually. So ensure that it's only for good and not for harm. Those are the basic considerations. But we've seen that what happens with data, especially when we are using IoT devices, or when we're using AI as driver, sometimes we tend to over glorify data. We tend to consider it as the ultimate point at which the intersection, any form of intervention can be done, or any solution can be offered. So we have to understand, I think, especially for companies that are doing the digital work, that this is just one point of which has to be considered in the entire treatment protocol or solutions that have to be provided to the patient. I think, there should be no hype or myth about technology. Technology is a limited, has got limited benefit, and it should be used, but that limitation should always be remembered. And other important sets of things that work around the patient's benefit also are equally important. Those considerations. I think, the other thing is that the concept of conditional good, that there are always conditions attached to how the data can be actually relevant and good. We cannot forget the conditions, because most of the time when, especially startups and companies who are trying to collect data to make some tangible solutions out of it, tend to only look at the compliance bit of it. So we're only considering the compliance. Sometimes the ethics are not something that, because there is a little gray zone, the ethics zone is a little gray. So you know the compliance is there and these certain compliances have to be done. So the compliance bit is adhered to, but the ethical bit sometimes is not on top of mind of people who are developing these systems and collecting that data and then eventually using it, whether to build AI algorithms or to offer any sort of solutions to people whose data it is there. Privacy and security, everybody's already spoken about, but other panelists were mentioning that, for example, it's very easy for Google to understand a person's location and then to trace a person back because Google probably has all forms of comprehensive data. So that's another thing, because privacy and security on paper may be easy to say that we are maintaining privacy and security, but considering the technology is so intrusive and sort of disruptive, I think privacy and security are also, there has to be a double layer of privacy and security on the data so that there is no breach of any privacy or security for people who are part of that data collection exercise.
Thank you, Dr. Manjari, for saying that. I think when it comes to the wellness space, I think it's very, very important because one is, of course, individual personalized, because you're not ill, you this your very, very personal data, and similarly society kind of a thing. I'll give an example for that matter. If it is used for the right purpose, it's beneficial. Like suppose I get to know in a village or in a community or a district, every day as a diagnostic test, I'm getting more dengue, patients are dengue positive. So I can use the data. Oh, there's some kind of a endemic or epidemic likely to happen. So I rush my forces out there. But it could be, the way the business house. Somebody is talking about, okay, and it depends on the habit, about some large number of people interested in the wellness in that particular society and particular district, and they come back and you have a lot of protein supplements probably offering. So probably the communities will say, oh, this is the best market for protein shop. Let me open 100 protein supplement shop. And whatever visible then, probably it's sold. I think you need to keep a big balance about it. That is where it's very, very important. What is right, what is not right. And I think equally important that society gets aware of it. And of course, individual and of course, the companies are using the data, they should be very, very careful about it. I think compliance need to be done and probably some regulations will follow. Now, with that, I think we'll come back to the last question again. I think Dr. Srivastava is back, sir. Sir, I think I just would have a last, 2 minutes comment from you, sir. Is the current legal framework sufficient enough, and or we to revise and adapt to law? So because we have regulators, but I think legally, I think where do we state today? If something goes wrong with AI tool, what is going to be action and what should be the remedy with us? You're a mute, sir. Can you open it up? So we can't hear you, sir.
Now you are able to hear me?
Yes, sir. Yes, sir.
If you look at the things which are happening globally, you will see fast change taking place in US and European Union. And there are various type of legal system which are being developed so that the regulatory system takes care of things in a right way. And if they are doing it in a wrong way, they can also be taken care of. But they are all formative stage. Nothing has been established as far as the law is concerned. Now, the India, if you just look at the India or the Southeast Asia, India is little bit behind as compared to other countries in this region, because we have a legal system which is difficult to penetrate for bringing about change. And I don't know whether the process has started in the Indian system or not. But as far as the need is concerned, it is very much needed. Now, the period in which these legal system, regulatory system, and the hybrid system develops, they are the areas, they are the time, they are the window of opportunities for aggressive marketing for India. Now, these aggressive marketing is taking place. Whether you look at ChatGPT, the new version, which is a self-solving type of version, whether you look at the various type of clinical decision support system, or whether you look at the various type of clinical trial and pharma companies utilizing the database which is being created, all are coming in a very fast way. So on one side, there is a fast mode of actions. On other side, there is a lack of regulation and there is a lack of the legal protection. In that particular system, which I call a window of opportunity for business, there will be a growth of the business. There will be new technology coming in, but it will be confined to tier 1, tier 2 cities, or mostly in the tertiary care area. We will lose the advantage of having a good, legally backed, regulated hybrid system in the primary care. That is what is my feeling, and I have been openly talking about it in the different forum. But the fact is that still the things are not moving the way it is moving. I work in the primary healthcare. When I tried to introduce a primary healthcare system strengthening database and a software being developed for the primary healthcare manager, I started working with the World Health Organization. They gave me a project. I tried to build it up and I tried to link it up with the budget impact studies, how much money saving it is doing, how much is the return of investment. At the end of the day, in a deficit economy like India, when it is going to meet the requirement of primary health care, it should not be cost intensive, it should be cost saving. Only then it will be sustainable. So that can only be possible when we have got a very strong legal system which can protect the regulatory authority so that they can make regulations which are large, masses friendly and can help us reaching the healthcare services up to the last mile person. And I tell you, it is definitely possible with the way the government is moving forward. The only thing is that there are unconnected dots which need to be connected. Government has got a sandbox, government is doing ABDM, government is moving forward, but it is top down. The bottom stuff is not coming up. So that is where I think a community participation, Jan Bhagidari, a type of participatory approach, an authority, a legal protection system, a redressal system, like we tried to develop in the Clinical Establishment Act. So that is what is there in my mind. That is all I want to share. Thank you.
Thank you so much, sir. I think
Dr. Gore, I'll just take a minute. We need to close the panel discussion next 2 minutes, please. Request you to wind up.
But just thank you so much, sir. I think for saying that. I think what we require is basically a participatory kind of a thing and a collaboration amongst all of us. So now we just have 2 minutes. So I'd like to just leave it open. One, Arun, anything you want to say the last minute punchline, or Arun, you can start from here.
Yeah, as Mr. Srivastav has clearly mentioned about the regulatory thing and initiative about the public health and mentioned about the ABDM. I would put it in a different way that, there should be some regulations across the healthcare arena where frameworks should be imposed across, uniform framework should be imposed across the healthcare services. That will help us in integrating and making the data interoperable across the industry.
Vasant.
Just one line, sir. As everyone pointed out, we need international consistent frameworks with a local adoption addressing the social, cultural, and existing problems. That's the need of the hour.
Great. Dr. Manjari, please.
Yeah, I think one of the important things is to create a model for ethical considerations and make it like a roadmap that others can follow. A lot of technology companies can invest some time and effort in creating a model, something that can become a roadmap for many more to follow, because most of them are sort of hunting in the dark. So I think that would be helpful.
Great. I think, thank you so much, everybody. I think the need is, I'll say that the essence of our discussion, probably what we feel is lies in finding an equilibrium. basically a delicate equilibrium that upholds the spirit of innovation, respects the sanctity of personal privacy, and ensures the robustness of collective security infrastructure. I think all three is very, very important. It's not a task to be done taken lightly. For the decision we make today will reverberate throughout the future and shaping the ethical foundations upon which our digital society will stand. And this is very important for the healthcare. Let us remember on principle that should guide us. I think that's something the takeaway we can have. Ensure that the benefits of technological processes progress are accessible to all without compromising the privacy of individuals or compromising the security of our community. Let us make people aware. Let's work together, develop a regulatory framework or participatory. If not, government probably is doing its own work. But I think all of us together at our own level probably come back and make a collaborative kind of a thing, at least a parallel model, at least what we feel that and what society needs can be created. Develop and implement an ethical framework that only keep pace with innovation, but actively shape its trajectory towards a more equitable and responsible future. And with this, I'd like to thank everyone and for being here and sparing your time and valuable wisdom. And I look forward for a robust system coming forward. And I'm sure all of your leaders out in the field, we will be able to collectively do something. And thank you again was this digital forum. And thank you, Sagar, to the team. Thank you very much for being here. Thanks again.
Thank you so much, Dr. Ravi Gaur and all the senior panelists from the industry. Before we conclude, sir, there are many questions which came up, and we have taken one of the questions as an FAQ basically. It says that how a data breach affects a patient. Also, based on the recent incidences, what lessons can be learned? So we thought, I mean, this is something pretty much relevant to understand, and I leave the forum open for answering, sir.
Arun, can you take that?
Yeah. So obviously, when data breach happens, patient privacy gets impacted and individual gets impacted upon. So we need to create a system where patient privacy and patient data is maintained in such a fashion that in case of data breach, patient information doesn't get compromised and doesn't get revealed in the public forum. So that is a one piece when the data, and we need to in the healthcare system, we need to make sure that all the data is so encrypted and stored in a fashion that in case of any data breach, individual patients' information doesn't get leaked out into the public forum. So obviously, any data breach impacts patient, obviously. That's a one piece. Second is your precious data, healthcare data information goes out of your hand or out of your country when any such type of data breach happens.
Oh,
Anybody
great.
wants to add something?
Thank you so much. Yeah.
Anybody want to add to whatever Arun has said?
Pretty much answers, yeah.
Okay, fine. Great.
Great. Thank you so much, all the panelists, and thank you so much, Dr. Ravi Gaur. We will definitely would love to see you in person very soon. We will be coming up with the physical edition of the event in the months to come, and we'll definitely inform you about the updates on that too. Thank you so much, all of you, and look forward to meeting you very soon.
Pleasure having you here. Thank you so much.
Thank you.